Dr. Rod, thank you so much for taking the time today. It's always a lovely and fruitful discussion to have with you. Just to set the scene for our audience today, our primary discussion would focus on behavior and self management. But not just theory, we would like to reflect some of your past work, the clinical researches that you have conducted previously. The purpose is by reviewing these frameworks, we would like to understand how such similar principles may apply to other behaviors like smoking. And in general, when speaking of behavior and self management, is there a method or a particular approach we could follow?
Well, thank you for having me. It's always a pleasure to be here. The behavior is what we do as human, and substance dependency is also one of our behaviors. And there's usually different reasons that a behavior emerges. There's usually the biological, psychological, or social reasons. That's why we call it biopsychosocial phenomena. And these elements of reasons or history of life leads into different types of behavior. So whatever we want to do in medicine, there is some element of behavioral change related to it. That's why it's important. It has always been a component of my philosophy of care and my practice.
Okay, since it's always been a component of your philosophy, this brings me to the question that, and it's a simple question. We would like to understand, what was it that actually you were trying to solve when this work initiated in the first place?
Yeah, you're referring to two studies that I've done through my practice, and we published on them. We were dealing with different issues, and as you said, problems through our practice. One of them was that we wanted to improve the outcome of our treatments, but being a pain doctor, usually the practices are focused on the level of pain. But I realized that you have to look at the whole person, and you have to elevate the whole level of life in order to deal with the behavior change that would lead into better outcomes. The success would not be only reducing the pain from a level 8 to level 5. That's a remarkable improvement, but that doesn't mean that really the quality of life or the level of life has improved. So the focus should be on function and elevating the whole life experience while we are working on the pain. That was one issue that we were trying to deal with, and through that I worked on a systematic observation of 200 patients that led into a publication in 2016, that we looked at different elements of education that patients can have related to their mobility, their diet, their mindset, that would lead into betterment of their outcome. And it was statistically significantly positive. So we had the publication, and the outcome of the treatment improved. And also we followed the elements of providing online education, health education, self-management for patients in order to improve their outcome. That was one problem we want to solve. Historically, we have been dealing with a major issue in Canada, and that's opioid crisis. As a matter of fact, it's a global problem. But here in Canada, we lose something between 6,000 to 7,000 people every year from opioid overdoses. And that was another reason that we wanted to deal with in our practice and try to improve. That's why we did the second publication in 2019 with the study of medical cannabis opiate reduction program, that we provided education to patients. We use the chemical substance medical cannabis, CBD, in order to reduce the level of opioid that they use. So the problems of self-management and opioid crisis were the reason that we wanted to solve.
It is interesting, now that you have brought it up, one of the key points that I have noticed in your studies is that it wasn't only substance-related or opioid dependency tapering. In your studies, you have this framework that it says, as part of this process, you need to have the readiness for change, psychological and pharmacological support, as well as careful monitoring. So, this brings me to the question that at the early stages of this program, what were your observations? And I'm trying to understand, did patients feel a reduction in their pain levels? Did that come with behavior change or a shift in mindset? So, what are the early observations when this program initiated?
Well, my philosophy of care starts with the mindset. You change your mind, that will change your life. So that is the philosophy of care. My method, the mind-body temple method, starts with, finding what initiates the energy for patient to do the effort to change. Because change is difficult, but growth happens only through difficulty. So this is the way that patients would start to have clarity about the reasons that are important for them to change. And then that will give them enough experience, energy to go through the changes.
Okay. So you talk about the energy, the motivation, the readiness for change to go through a process. But, I mean, once again, what I've understood from your study and your kind discussion here is that it isn't about substance specific, it's behavior specific. I mean, it could equally have the same weight. I don't know if that would be correct to say, but what I'm trying to understand is what parallels do you see or did you see during these studies between opioid or substance dependency and other behaviors? Is there any significant or meaningful relation here?
Yeah, exactly. That is, we see the symptom, but there is a whole life story behind the symptom. And that's the concept of biopsychosocial parallel that you see in every single behavior of the patients. So there is usually a history of either childhood adverse experiences, emotional trauma, lack of self-esteem, lack of coping skills, some sort of pressure that the person feels in order to move towards a substance that would calm down that irritation of not feeling enough or feeling the pain. So instead of asking, why the addiction, we have to see why the pain, why the discomfort, why the adverse experience. And what is it? What is it that the addiction is doing for the patient? Instead of trying to deal with the addiction as a symptom, we have to get to the source. What they use addiction or the chemical substance or behavior that is like smoking in order to calm, and why that irritation is there. So going one layer down to find out the source of the discomfort, that is the psychological aspect of it. And there are biological elements. When somebody takes an opioid or smokes, it takes very short period of time for this chemical to get to the brain. And there are circuits of memory and reward system and chemicals like dopamine that are involved. So there is a whole biological aspect that's there. And there are social elements as well. Trying to fit in with groups or trying to calm the anxiety of not feeling enough in order to play a role in society. And unless we pay attention to all of these different aspects, we can't heal the wound of addiction. And there is also the elements of clarity about why they want to make the change. So that comes to the element of motivation and motivational interviewing, which is a big component and part of all of the addiction programs. There is this element of making it clear for the person, why is it relevant to their life to make the change? And, why this would be risky, and what are the risks that they need to address if they don't make the change? And then what are the rewards that they would get if they make the change? And how bad do they want to make these changes? This element of incentive to change has to be in front of the eyes of the person. Because as I said, change is difficult. but it's only through the difficulty that growth happens. So they need to be motivated, and motivational interviewing is a big component of all the programs that are out there in order to make the change, and it was a part of our program as well.
Interestingly, since you have brought it up, and we said we're going to discuss this, so smoking and the topic of smoking cessation in a specific, if you would like to call it a behavior or a habit, and how would you describe if someone is looking to put away this habit, to quit smoking, and it's a behavior and many people struggle with. So I'm trying to understand, how does it happen in a typical smoking cessation clinic? I mean, is there something else that needs to be done as if I'm the patient? I mean, is there something the patient fails to do and they set back into relapse when they're trying to quit this habit?
Yeah, first of all, we have to face the problem that we are having and be honest about it. One of the reasons that in North America we had the opioid crisis was that something more than 20, 25 years ago, all these big pharma companies came and said that pain is undertreated and opioids don't have any end organ toxicity, so prescribe opioids. And the level of education that many doctors had or about pain courses that they had through their training was very minimal. So they were in a position to give wrong information to physicians. And unfortunately, that led into overprescribing opioids, and then we had the opioid crisis. Similar to that, we went through a history of companies that manufacture tobacco companies, explaining to people that, you can use tobacco to relax. There were a period of time in early 60s that, advertisements would say, when you come home, you can smoke, or at work, if you are stressed, you can smoke, and it will relax you. So discounting smoking as just a habit was a part of education that was given to people, even in some schools. But in reality, smoking is an addiction, and we have to accept the reality of it. When we start smoking, in about 10 seconds, the nicotine gets to the brain, affects the reward system, and dopamine is released, and people will feel better. But we have to get back to the, again, biopsychosocial element of why we need that kick of dopamine. What does it do for us? What is the baseline reason that we get to the need of that element of relaxation? What is stressing us that we need that relaxation? So we need to go one layer lower. That element of the reason should be clear for the person. And the reason that many of these programs don't get started, again, we have to look at the problem we are facing. Something about 8 million people die every year throughout the world because of smoking-related reasons. And 1.2 million of these are secondhand smokers. So many of our loved ones are dying because of our smoking if we are a smoker. So being honest about the problem and then looking at the source of the need, whether it's, feeling that we need to fit into the group of the society that we feel attached to, or the peer pressure, giving into the peer pressure, or the stress that we need to calm. Unless we don't recognize the reasons, then the reasons are always there and it will pull us back into the smoking. That's one aspect of it. The other is the element of readiness. In any program, when you go to any average smoke cessation clinics in the countries that they have this program, it starts with the question whether they are smoking or they're not smoking. If they're not smoking, usually education is provided about prevention so they don't become a smoker. If they are a smoker, then there is, if they are ready to, if they have thought about cessation of smoking, if they have thought about it, are they ready, how ready they are, and then what they are ready to do in order to achieve the goals, how important it is for them, and then, providing them with information, providing them with facilities that they need, or medication if they need. And that's usually the process. And there is some element of cognitive behavior therapy that is always there to help them to change their mindset, as we talked about. Because when you try and you fail, then this false belief emerges that maybe I'm not able to quit. And that becomes some sort of a false belief that leads into continuation of smoking.
I mean, you just clearly mentioned this, and I want to emphasize on this point. Relapse. Relapse is often treated or classified as failure. Is that true? But I think this is the common belief. Like, is that true, or is it part of the process? If it's the part of the process, I would like to further understand your approach. You have Mind, Body, Temple, the book which you have beautifully written, and you go through stages that relate to self-management, self-care, and the psychological shift that we all need to get there for the change. Please tell us more about the Mind, Body, Temple approach. How does this would help an individual think differently, do differently, and how would it may affect an individual's day-to-day decision-making process?
Yeah, first of all, about the issue of failure and translating relapse as a failure. I mean, it's all about the mindset. I always tell my patient that if you relapse, you have to congratulate yourself for ever trying to quit, because you only get to relapse if you have tried to quit. You know, many people get stuck on that stage of not being even able to start the process of quitting. I've never been ready enough to try, and you do not succeed unless you try. So you get to have the relapse if you try, and as long as you try, you can one day succeed. An average person may, as they call it, fail or relapse more than 7 times before they are able to completely quit and come out of this habit or addiction. So, you know, it's like fear of death, but you only get to die if you have ever lived. So, you know, the people who die are the ones that were lucky enough to have ever lived. The number of people that never lived is always more than the people that they had the blessing of ever have the opportunity of living. So it's the same thing. Relapse is not a failure. Relapse is a part of the journey. So if you have to look at this whole process as a journey, and that's what the Mind by the Temple does. That's the journey of life, elevating your life while you are dealing with the problem, whether it's chronic pain or addiction or smoking cessation or any other issue you want to change. It's very hard to imagine a journey that starts from a highway and ends in a highway. Usually you go through peaks and valleys until you get to the highway as a part of your journey, and finally you get to your destination. So any journey goes through different stages, and that's what we try to give people, the structure of the journey of healing, that it starts with the steps related to, you know, why you want to change and how important it is for you, why is it relevant to you, and what it will change in your life and how it will make your life better. So that clarity will give you the vital energy to take part into this journey. That is the fuel of your fire that you need for this journey. And then it's also when we talk about, I'm, feeling that I'm a failure if I relapse. That's how we talk to ourselves. Like if you want to talk to a loved one, you never talk to them in a harsh way. You always try to give them encouragement. You always try to give them guidance. But when it comes to our selves, talking to ourselves, we usually use a very harsh language. And feeling to be a failure because we relapse is a part of that harsh language. So as a part of making peace with ourselves, which is part of the foundations of Mind by the Temple methodology, we usually recommend people to be very mindful on how they talk to themselves and whether they consider telling a loved one, oh, you're a failure every time that they cannot do something, or we congratulate them for ever trying to succeed. And one day they will succeed because they try. And that is the change in the perspective, change the dynamism, change the paradigm of shift in mindset in mind body temple methodology. And then the skills come to your help. The cognitive behavior therapy skills that we use in order to apply to the circumstances that would lead into relapse.
So, very clearly said, failure is part of the process. You would never know the outcome or the results unless you have tried. But please help me understand. I mean, you touched upon it, but I would like to understand. Let's say I don't necessarily want to face relapse. I do not want to fail. But what tends to happen, or what are the early signs that me as an individual can look for or be aware of during the process to prevent relapse? It's not necessarily my intention. I'm going through this journey, the process, but I just want to know, is there signs that I should be mindful of in order to avoid the relapse, to avoid the mindset of failure?
Yeah, again, it gets back into the question of what is addiction doing for you. You know, we think that we need to resolve the symptom, but we have to pay attention to the source. As I said, there is either some biological reason that people need the urge, and that's the dependency side of the chemical dependency side of the addiction, or psychological, which is related to past trauma or existing stressors, or the social, which is the environment that we are in. It's very difficult if you are among a group of addicts that are abusing chemical substance in order to quit individually. So you have to probably take the effort or make the effort to change the environment. And these biological, chemical, psychological, or social elements need to change in order to prevent the symptoms. So we have to deal with this before it gets to the symptom of feeling the urge to have the relapse. But whenever there is a urge, there is some thought, or there is some emotion, or there is some biological reason behind it that we have to pay attention to.
Correct me if I'm wrong. So my take is that it's always not necessarily about quitting an existing program because it will not work, you know. But it's rather about complementing a series of behavioral changes, mindset shift, the readiness, being eager to take action or to change something. So for patients who are going through this process, or somebody who is at the early stage of going through this process, what is your advice? What would you like to say to them to guide them through this process, to prepare them mentally ahead of the journey that they have?
Well, the most element is the element of hope. First of all, it's important for people to know that there is hope for change. And change is difficult. You know, you have to use the biology that you have, the machine that you have, that led into addiction, and use the same biology in order to save you from the addiction. And what's that? That's the neuroplasticity. How does neuroplasticity work? That's by change of mindset and repetition of the practices. You know, the reason that we are using the element of, you know, whether it's a behavior addiction or it's a chemical substance addiction, is that we keep doing that stimulation to the nervous system, and the pathways of nervous system get adapted that way. The same biology can be at your service to come out of that and then elevate your life to a better level of living. But it has to be started by the element of hope. We have to believe that change is possible, and we are here, or there are many resources out there to help them. But as long as they fall into the despair that there is no hope, then there is no change that will happen.
I would like to conclude this statement of yours, and correct me if I'm wrong. So change, behavioral change, is not necessarily willpower alone. It must come with readiness, support, and a structure.
Yeah.
Can you tell me the tools, or at least guide me, where I could find and mentally prepare myself for readiness, where I could find the support or the structure that I want to?
Yeah, like I said, it's a process, and as you mentioned, it starts with the mindset. It starts with the understanding that there is hope, and then understanding the concepts and learning the skills that are taught to patients through clinics, or I try to mention most of them in my book, in Mind Body Temple, and through our program, through the website that we have, mindbodytemple.ca. Or there are many other resources that if you search about any of the smoking cessation or opioid reduction, there are so many guidelines, there are so many online resources that are out there. But what is important is that we believe that if we change our mindset and then we start the practice, gradually it becomes a part of your habit. And then when you continue the habit, it becomes a part of your character. And when you continue the practice that is part of your character, then it becomes a part of the way you are. So we move from understanding and doing to the way of being, movement from doing to being. And that becomes your new level of life. So we need to understand that the focus should be on elevating the life, increasing the level of vital energy, increasing the level of vital health, the whole health approach, the whole person approach, while dealing with the problem. And then comes one day that we will thank the problem because that led us into the journey of bettering our health and bettering our life. So it's a process. There are a lot of resources out there, but it needs a structure, and the structure is through a method that will guide the journey of healing. And that's why I always believe that there's a lot of knowledge out there, but it's a methodology that will help you to get to the destination.
Thank you. I mean, and I would just like to compliment your words that I have personally began reading Mind Body Temple. It is an easy to understand and easy to follow method. And I would like to recommend this book to anybody who's almost there, but just needs a little further push to go through this journey. I strongly recommend to read Mind Body Temple. But besides this brings us to the end of our conversation. And is there any other words that you would like to speak today? We will be gladly hearing.
It's important to know that when you heal yourself, you heal others. And it's not selfish to love yourself. It's through loving yourself that you are able to love others. And paying attention to your level of health, elevating your level of life, is participating in betterment of the whole world. So pay attention to your mind, pay attention to your body, rebuild your mind-body temple, and through that journey, you're going to heal yourself and heal others.
With that said, thank you very much for taking the time today. It's been a wonderful and meaningful conversation, like always. Thank you, Dr. Kevin Rudd.
Thank you for having me.